expired, spoiled, and wasted vaccines. Next slide. Just some housekeeping reminders. Please make sure you're muted throughout the presentation unless you are the one speaking. Reminders for our QA team, please continue to monitor the chat for any questions you might be able to answer. To our attendees, today's session is being recorded. The slides and the webinar recordings will be uploaded to our DOH website, link there. And if you're wanting to be added to the Hawaii VFC program email list, please email your request to hawaiivfc@doh.hawaii.gov. And in the subject line, please write email list, including all your information. Next slide. If you have any questions during today's webinar, please use the chat to ask them so that a Hawaii VFC program subject matter expert can respond directly to you. We will be answering any other questions you may have at the end of the presentation. Next slide. And then I'm going to pass it over to our presenter today, Lorraine Lim.
Hi, good morning. The objectives for today, by the end of the presentation, providers are able to identify and describe the types of vaccine loss, identify reasons for negligence resulting to vaccine loss, and understand what to do and how to report expired, spoiled, and wasted vaccines. Next slide, please. Let's talk about vaccine accountability. Vaccine accountability is one of CDC's highest priorities and an essential component of the VFC program. The VFC program has the primary responsibility for developing and maintaining vaccine accountability systems, which ensure that vaccine loss and wastage is minimized, protect against fraud and abuse, ensure that vaccines purchased with VFC funds are administered only to VFC eligible children, and ensure the proper apportionment of vaccine purchases based on the VFC eligibility data for population. Next slide. It is important that VFC providers account for and store VFC vaccine appropriately to avoid loss of vaccine due to expiration, storage and handling issues, and administration errors. So the following are reasons for negligence, and it includes but are not limited to the following. Not being available to accept or receive a vaccine delivery during stated vaccine delivery hours, failure to store vaccine promptly upon arrival, storing vaccine in a refrigerator or freezer unit that cannot consistently maintain the required temperature range, freezing vaccine intended to be refrigerated and or refrigerating vaccine intended to be frozen, failure to check and document vaccine storage temperatures twice per workday, failure to download and review DDL data for any out-of-range temperature, failure to follow vaccine storage alarm response protocol for power outage and unit failure, failure to rotate the vaccine stock, resulting in preventable expired vaccine, and any other preventable incidents made by providers. Next slide. The Hawaii VFC vaccine loss. So during the federal fiscal year 2023, over 8,700 doses of routine VFC vaccines valued over $540,000 were reported as expired, wasted, or spoiled by Hawaii VFC vaccine providers. And note that this figure represents only routinely administered vaccines and does not include seasonal or allocated VFC vaccines like influenza and COVID-19, for which wastage is expected to occur on a yearly basis as new formulations become available. So that is why we require that VFC coordinators are properly trained and have clear understanding of the VFC requirements and recommendations, because that amount of vaccine loss is huge for a publicly funded vaccine. Additionally, compliance site visits are conducted to provide an opportunity to identify potential vaccine accountability issues and educate providers and determine whether vaccines are stored, handled, and administered in accordance with the VFC program requirements. Next slide, please. The types of vaccine loss. So we have spoiled or expired vaccines, which is returnable, and the wasted vaccine, which is non-returnable. So for the spoiled and expired vaccine, these are any intact, that is, vials or pre-filled syringes must be kept and unused. Non-viable vaccine, VSC vaccine vials and pre-filled syringes, including expired vaccine or vaccine that has been spoiled as a result of the following: vaccine expiration date exceeded, failure to store properly upon receipt, refrigerator or freezer too cold or too warm, natural disaster, power outage, hurricane, etc., spoiled in transit, cold or frozen, or warm or defrosted, spoiled, and other reasons, provider must state other reasons, mechanical failure or technical issue, recall, and other reasons. For wasted vaccines, these are vaccines that are non-viable, that cannot be returned to the Hawaii VFC program, and it's considered wasted vaccine. This vaccine should be reported to the Hawaii VFC program, but cannot be returned to the CDC contracted vaccine distributor, McKesson. The following wasted vaccine products are not available for federal excise tax credit and should be disposed of as medical waste by the provider. So this includes broken vial or syringe, vaccine drawn up into syringe but not administered, lost or unaccounted for vaccine, non-vaccine products, open multi-vial dose, but all doses not administered. And please note, open expired multi-dose vials of the IPV vaccine must be reported as wastage and disposed of at the provider office. And other reason that the provider must state. Note that open vaccine vials and pre-filled syringes cannot be returned to McKesson and should be reported as wastage and disposed of at the provider's office. Next slide, please. So what can you do about expiration, wastage, and spoilage? You need to plan, know, and act. Next slide. Plan your VFC orders. Do not go on ordering autopilot and continue to request the same amounts of vaccines if they are no longer regularly administered. So vaccine loss due to expiration is frequently a consequence of over ordering and poor inventory management. So you just have to order enough for at least month in advance. With greater availability of combination vaccines, the Hawaii VFC program has observed a sharp increase in wastage of DTaP and Hib products. If your office primarily administers combination vaccines, reduce orders for the individual vaccine components accordingly. TD vaccine supply is currently constrained and should now only be ordered for administration to persons contraindicated to receive pertussis containing vaccines. See the link for more information. And for most persons, Tdap should be administered instead. Next slide. Number 2 is know when vaccine is truly spoiled or wasted. Do not discard open multi-dose IPV vials after 30 days, with the exception of COVID-19 vaccines in multi-dose vials that do not require reconstitution contain preservatives and can be used through the expiration date printed on the label as long as the vaccine is not contaminated unless otherwise indicated by the manufacturer. You can see the package insert link that's saying that 30-day beyond use date is not indicated by the manufacturer. If a temperature excursion occurs, do not assume all affected vaccines are spoiled. Activate your emergency vaccine storage plan and continue to store affected vaccines at appropriate storage temperatures. Label do not use and follow with vaccine manufacturers and the Hawaii VFC quality assurance team to determine viability. Next slide, please. And act. If you do have expired or spoiled VFC vaccine on hand, report it to the Hawaii VFC program and initiate a return to McKesson within 6 months. The Hawaii VFC program receives excise tax credits for each vial returned, which allows for recovery of a portion of the funds lost due to expiration and spoilage. Note that all unused or intact, expired and spoiled VFC vaccines are returnable, including VFC influenza and COVID-19 vaccines. Next slide, please. And how to report expired, spoiled, and wasted vaccines. So we have a link here. This link goes directly to our VFC toolkit for vaccine return instructions. Next slide, please. So first is report vaccine expiration, spoilage, and or wastage either through the HIR, Hawaii Immunization Registry. We have a video or webinar here on how to do it, or you can complete the vaccine loss reporting form on the left and submit it to the Hawaii VFC at doh.hawaii.gov. Please note that returnable vaccine should always be sent to the CDC contracted vaccine distributor, McKesson, and should not be returned to Hawaii VFC program. Next slide. Second, Hawaii VFC program staff will submit your vaccine return or wastage information to the CDC. CDC will then transmit returnable vaccine information to the CDC contracted vaccine distributor, McKesson. Upon receipt, McKesson will have UPS send an email to the provider with a link to a UPS returns shipping label. The email will be sent to the email address providers specified in HIR, or this will be the primary coordinator's email address that you stated in the vaccine loss reporting form. And number 3, providers must check their specified email inbox for an email from UPS that contains the link to the UPS returning shipping label. Please ensure to monitor spam or junk email inboxes as well, since the email originates from the general UPS account. Provider should then click on the Get Shipping Label link to print their labels. So for your reference, the snippet on the right is an example email from UPS. Next slide, please. Fourth step is to pack returnable vaccines as follows. Note that spoiled or expired vaccines do not need to be packed in a cooler with ice. Vaccines should be placed inside a zip top or plastic bag to prevent leakage during transportation. Place the zip top or plastic bag containing the returnable vaccines in either a padded mailing envelope or box. If we're using a box, please ensure it does not contain any printed shipping warning labels. For example, that says that contains bleach or contains batteries. Enclose a copy of the HIR return list or vaccine loss reporting form in the box or padded envelope along with the returnable vaccines. And then affix the printed UPS returns shipping label to the outside of the box. And the fifth step is to either hand the box or envelope to the UPS driver visiting your facility to make a regular delivery or drop the package off at UPS retail location. Do not schedule a UPS pickup as your office will be charged for the service. Next slide, please. So the key takeaway, vaccine loss is both costly and preventable. And VFC providers must ensure accountability for publicly funded vaccines and are responsible for maintaining vaccine quality from the time a shipment arrives at a facility until a dose is administered. Therefore, a sound vaccine management practices related to ordering, inventory maintenance, and storage and handling are critical to minimizing vaccine loss and waste and potentially putting VFC children at risk from compromised vaccine. Next slide, please. That's it for the vaccine loss webinar. So contact information, if you have HIR technical login or issues, please contact the registry help desk at 808-586-4665 or email them at registryhelp@doh.hawaii.gov. For any vaccine ordering issues, concerns, questions, you may contact the 4 people on the list. And for any VFC related questions or concerns, you may contact everybody on the list below. Next slide, please. Thank you so much for joining us today. We will appreciate if you can take the post-webinar satisfaction survey. The link is in the chat. Yeah, thank you so much. Do you have any questions? So today's session will be posted in our VFC website under educational opportunities. So, and we will be here until 10 a.m. So if you think about any questions after this, you can pop it in the chat. Thank you.